An invasive strain of Group A Streptococcus gas is spreading at a disturbing rate across the United States, and the implications are far more serious than many realize. According to the CDC and a recent study published in JAMA, the incidence of invasive gas infections has more than doubled from 2013 to 2022, a steep and worrying climb that has gone largely unnoticed by the general public. This isn't just about strep throat. These are invasive infections, meaning the bacteria aren't confined to the throat or skin. They're entering the bloodstream, organs, and other vulnerable areas of the body, causing conditions like necrotizing fasciitis, also known as flesh-eating disease, septic shock, pneumonia, and streptococcal toxic shock syndrome, all of which can be rapidly fatal. And yet, many people still equate strep with a sore throat and a quick round of antibiotics. That kind of thinking is dangerous. More than 21,000 cases of invasive gas were identified in the study, leading to over 20,000 hospitalizations and nearly 2,000 deaths. These numbers are staggering, and they're just the tip of the iceberg. Many mild or moderate cases go undiagnosed or unreported, meaning the true scope of this threat is likely even worse than what the data reveals. Even more alarming is who this infection is hitting the hardest: older adults, residents of long-term care facilities, the homeless population, and people who use injection drugs. These are already vulnerable groups, and now they're at the epicenter of an escalating public health emergency. But young adults aren't safe either. The biggest increase in infection rates occurred among people aged 18 to 64, an age group that's typically not on high alert for bacterial infections of this magnitude. Doctors are sounding the alarm, but the healthcare system is not adequately responding. There is no vaccine for gas, and the medical community is scrambling for prevention strategies in the absence of one. While early intervention with antibiotics can reduce the severity of strep throat, once gas becomes invasive, the situation can deteriorate rapidly, often before symptoms are even recognized as serious. And the surge isn't confined to the US. This is a global issue, with spikes reported in both the northern and southern hemispheres since the COVID-19 pandemic. The link between weakened immune systems from recent viral infections and the rise in bacterial threats like gas is becoming clearer. But the public health infrastructure is still lagging behind, overwhelmed by ongoing challenges and underprepared for what's coming next. The social dimensions of this crisis cannot be ignored. Homelessness, drug use, and economic instability are contributing directly to the spread of this bacteria. The opioid epidemic, especially the rise in 4-fentanyl use, is creating ideal conditions for the bacteria to invade and spread. These are not isolated medical problems. They're systemic failures, deeply intertwined with the breakdown of social safety nets, inadequate mental health care, and neglect of at-risk populations. Children, too, are in the crosshairs. After a temporary dip during the COVID pandemic, strep infections in children, particularly those aged 4 to 13, have skyrocketed. One report from Epic Research noted that strep rates in 2023 were 30% higher than the previous peak in 2017. That's not a random fluctuation. That's a clear sign that this threat is accelerating, not retreating. And while hand-washing, avoiding shared utensils, and staying home when sick are all valid advice, these are minor measures in the face of a mounting bacterial epidemic. We're talking about a strain of bacteria that is now outpacing our capacity to contain it. In some cases, it's even being misdiagnosed as something milder until it's too late. Too many people, and even clinicians, are still treating strep as a seasonal nuisance. That's a deadly mistake. In its invasive form, gas is insidious and fast-moving. Even the world's best hospitals are challenged by its unpredictability and lethality. For communities without access to timely care, which includes a growing number of Americans, this bacteria can be a death sentence. We are dangerously behind on addressing this. There is no coordinated national campaign. There is no widespread public awareness. And critically, there is no vaccine. Without one, and without a stronger public health response, these infection rates will continue to rise. More lives will be lost, and more will suffer long-term damage from preventable complications. Infectious disease specialists are urging accelerated research, but funding and attention are limited. And once again, the burden falls heaviest on the most neglected corners of society. If we continue to treat this as a minor issue, we're going to pay a heavy price, not just in hospital beds and antibiotic prescriptions, but in human lives. The time for passive advice is over. We need public health campaigns, government funding for vaccine development, targeted intervention for at-risk populations, and a serious reevaluation of how we treat bacterial infections in a post-COVID world. Without bold action, invasive strep won't just remain a growing threat. It will become a full-blown crisis.